Alright, hey guys, this is part 4 of the first section of skeletal system, and I'm just going to go over a couple things with you. Which is just finishing up the facial bones and the bones that are found in the skull. So if you look at the front of the bone, the front of the skull here, just like the very front of the skull is actually called the frontal bone, and you have the parietal bones on the two sides. Temporal bones are these right here. That's right where you would, what people call the temple of their head. That's called the temple because they're temporal bones right there. And the nasal bone is in the front, right where your nose comes off. And your nose itself is not a bone, but it does have a bone up top that connects to the skull. Zygomatic bones here, you would consider those your cheekbones, which are just under your eyes there. The maxilla is the top of your jaw. Mandible is the bottom of your jaw. And you have this little tiny bone right in the middle of your nose, that nasal cavity right there, that's called the vomer. So let's look at a closer look at each one here. So the maxillary bone is this one right here. It comes all the way up here and around and all the way around like that. So this is the maxilla is actually two different bones. So there's one on the right, one on the left, and this right here is the fusion of the two in the middle right there. And this bone right here is considered what's called the keystone of the face. What a keystone is basically like if you have an arch over a door or something like that. If you just stack square stones on top of each other, you're going to come to a point where there's an angle, and so a square stone won't fit in there anymore. So what a keystone is actually like an angled shaped stone that you've probably seen in architecture and stuff. You may not have noticed before, but there's always a stone right in the middle that's kind of angled because it brings the two arcs together. That's what the maxilla is, like that keystone. And what the concept behind the keystone is, if you pull that out, it makes the entire thing crumble. So basically this maxilla right here is what holds everything together. That's why it's called the keystone of the face. It contains sinuses. Inside your face you have sinuses. You guys are probably aware of this, and some of you may have issues with your sinuses, especially around allergy season and stuff like that. Those are called paranasal sinuses. Para means around, nasal, so near the sinuses, or near the nose. These sinuses, they surround the nasal cavity, and one of their main functions actually is to make the skull lighter. And that's actually a good thing because you're holding your head on top of your body all day, and it's better if it's lighter, so you don't have to use as much muscle strength to keep it up there. So it also amplifies the sounds that comes through. So if you close your nose, people have done this before. If you put your fingers on your nose, it's gonna change your voice. Now, you've probably noticed that before on yourself. So that actually is because when you close your nose, you're closing off those nasal passages and those sinuses that are around your nasal area, and it affects the way the sound bounces off and comes out. So infections or inflammation in there can cause pressure in your face, headaches, and things like that, which some of you have probably experienced before. Palatine bones are up in what's called the palate of your mouth. I know you guys have all heard about the palate before. Some people use that as a reference to how much you can taste and things like that. But the palate is actually the top part of your mouth there, and it's made up from the maxilla and the palatine bone, which is behind it. So here's the maxilla, the two bones that are fused together, and then this is the palatine bone behind it, and it forms the back of your palate. And right before you get to what's the uvula, you guys are all familiar with the thing that kind of hangs in the back of your throat. That's called the uvula, and that's back here in what's called the soft palate. But the palatine bone makes up the back of your hard palate, which you can feel with your tongue up in the top of your mouth. If you have a cleft palate, sometimes what a cleft palate is that's missing, and that can be corrected with surgical intervention and stuff. But that's a congenital issue when you're born with it. So zygomatic bones, like I said earlier, that's your cheekbones. It's the blue ones here. They form a good sized portion of the side of your eye too. So that's this part coming up here. It's the blue. It's still part of the zygomatic bone. You have what's called lacrimal bones also. These are really tiny bones. They're like fingernails. This little tiny bone right here. It's called the lacrimal bone because lacrima means tear, and that's right where the corner of your eye is, and that's where your tears come down. You actually have a tear duct. It's called a lacrimal duct, which just lays right on top of that too. So that's right along the side of the nose there. Nasal bone, pointed at earlier, that's the two bones at the top of the nose there, and you can feel it on your face too. You can feel those that hard substance at the top of your nose. The nose is mostly cartilage, but then you get to a point where it gets hard, and that's the nasal bone up there. Vomer goes right through the center of that nasal opening, and when you look at a skull, you can see a little line that comes down the middle of it. That's called the vomer. And then the inferior conch, those are thin bones that kind of wave. They kind of come out of the vomer, and I'll show you in a picture here in a second. And those are just kind of coming off and also cause the ability of air to flow back and forth through your nasal cavity. So here's your vomer. Right here. This is the vomer right here, and this coming down here is the ethmoid bone, and these green ones on the side, those are the inferior nasal conch bones. So that's the inferior nasal conch. This is ethmoid, which we're going to look at in a second, and that's the vomer. So here's all the bones we just looked at: frontal, parietal, temporal, the sphenoid, which is in the bottom of the skull. You can see it through this picture. Here's the lacrimal bone here. Here's the nasal. That's the maxilla, mandible, zygomatic. And then again, that's the ethmoid. You can see it better from the bottom of the skull. And the sphenoid, again, also you can see that better from the bottom of the skull as well. So mandible, this is the biggest bone in your skull, and in the skull complex, and it's one big bone that moves separate from the rest of the skull. So everything else here is all fused together, but this is the only one that's separate from the rest of it, and that has a joint up in the top with the rest, and that's called the temporal mandibular joint, because the temporal bone here on the side is where it meets the skull, and this is the mandible, so it's called the temporal mandibular joint, or TMJ. You've probably heard that people refer to that before. Sometimes people say, oh, my TMJ hurts, or I have a problem with my TMJ. It's the joint between your mandible and your skull. And this is just a joint that allows that bone to go up and down. So it allows you to talk, it allows you to eat, allows you to breathe, and all kinds of things. So the mandibular body is the lower part where the teeth lie down here, and then the rami, or ramus is one of them, rami is both. That's the kind of the angle over there, and you can feel that on your jaw, that comes off the end of the mandible there. Hyoid bone is an interesting bone because this is the only bone in your body that doesn't connect to something else to make a joint. As far as another bone, it doesn't connect to another bone. It's kind of formed like the mandible, but it actually ends up down in your throat area, up in front of your trachea, and the only thing it's connected to is your tongue, actually. So it connects to your tongue, and it helps with swallowing, and it helps with the movement of muscles and things in the front of your neck there. Fetal skull. We talked about this before when we first started talking about the skeletal system. When you're first born, your skull is a bunch of separated bones that have holes in them, which are called fontanelles, and those all allow for flexibility so that when the baby's born and born through the vaginal canal, then the skull can kind of compress and move so that it's easier for the baby to come out during the birthing process. So the face is very small compared to the rest of it, and then eventually it'll grow and build. So the adult skull represents about 1/8 of the total body's length. Infant skull represents about 1/4. So it's a lot bigger, and you guys probably noticed that if you have baby siblings or have taken care of babies. Their heads are pretty big compared to the rest of their body. It's because they got a lot to grow into. So you have all these different fontanelles, and they do have names. Here's the parietal bone, the frontal bone, the temporal bone, occipital bone, bones that we've already talked about. And then you have anterior fontanelle, the sphenoid fontanelle, it's right by the sphenoid, which is down here, and then the posterior fontanelle, and then the mastoid fontanelle. Eventually, as you get older, there's going to be a bigger kind of projection coming off the bottom of the skull here, and that's called the mastoid. So that's why that's called the mastoid. This is called the sphenoid because it's by the sphenoid bone. It's called anterior because it's anterior, and this one's called posterior because it's posterior. So also, these things, these lines, these are called sutures, which will eventually fuse with each other. Those all have names also. You have a coronal suture, which is like the frontal plane. Remember, that also is called the coronal plane, so it's going along the coronal plane. It's called the squamous suture. Lambdoidal suture. And the reason why that's called the lambdoidal suture is because if you look at it from behind, it kind of makes a triangle or a lambda, which is a Greek letter. So, and then you have sagittal suture, which just like our planes again, sagittal plane goes along this sagittal plane. So those are all the sutures and fontanelles that you'll see in a baby's skull, and that's a cartilaginous material, which, like we learned in both tissues and the beginning of chapter 7, that cartilage is hyaline cartilage, right? Most of the baby's skeleton is hyaline cartilage when it's born, and then it grows into it. So it has that hyaline cartilage still, and you can actually feel the pulse in there because it's got blood flow going through there, and they gradually convert it to bone. And by the time they're about almost 2 years, somewhere between 1 and 2 years, you won't really feel those fontanelles anymore. The skull will be pretty solid at that point, which it needs to be, because that baby's going to be active and it needs to have that protection. So that is the fourth part of the skeleton, and we're going to finish up with part 5 of section 1 coming up in the at the beginning of next week.